All right, there's a couple of recovery hacks we like to tell our patients. One is icing. How to effectively ice your eyes. There's so many different ways of icing, but I have found the most simplest and effective way of icing is using frozen bag of peas. And I generally tell my patients to apply a piece of gauze over their eyes, which we provide, and that creates a barrier between the gauze and the frozen bag of peas, and then apply the frozen bag of peas on top of that. The frozen bag of peas are effective because of the weight that they have and also the degree of temperature is perfect when it comes to pain relief and discomfort relief when it comes to icing. So those two together allow frozen bag of peas to be really effective for my patients. Second hack is sleeping on your back. A lot of patients are just not able to sleep on their back. Some sleep on their side, a lot sleep on their stomach. We definitely do not like stomach sleepers when it comes to after surgery. Obviously, you have sutures on your eyes, so if you're sleeping on your stomach, you're probably going to be rubbing against those sutures, so we don't like that. Encourage patients is to apply, some pillows on the sides of their head, but a hack that we have is a set of pillows that we found online that we can recommend patients to purchase before surgery, which allow for the patients to sleep comfortably on their back without having to going from side to side. So we can certainly provide that link to patients that really are concerned about not sleeping on their back after surgery. Everybody's different. For instance, when it comes to me, I've had several cosmetic procedures and I've had to recover for a few days to a week afterward. What did I do without going crazy? I like to meditate. I don't meditate all day, but I'll meditate a few times a day. That's one way for me to kind of keep my mind at ease. And I still do that every day. I do transcendental meditation. It works for me. Audiobooks, podcasts. I love podcasts. I love audiobooks. And these are ways that have gotten me through my time where I needed to relax and recover. 3 is having the TV in the background. I don't want my patients to be binge watching TV all day, but having the TV in the background, in the distance, for instance, where you can listen to something in the background, completely fine. Phone calls. You can still have active phone calls with family, friends, absolutely. So try to avoid these emotional responses such as screaming, crying. There are still risks and complications I discuss with patients. The most common ones are some bleeding and bruising and swelling. It's expected. It's expected to have those. Those will get essentially improved for the first few days. By 2 weeks, most of the bruising and swelling should be gone, about 80% or so. Blurry vision. It's normal to have blurry vision for the first week or so, and that is common because of the incision that I'm making, the healing process, the drops that you're putting in perhaps, the ointment that you're putting in your eyes. That is very normal. So patients need to understand that looking really at fine print for the first week is difficult. So try to take it easy and minimize the use of your eyes. It's common to have some dry eyes after a lower lid blepharoplasty. It's usually not a permanent thing, it's usually a temporary thing. So if it's anything more permanent, I'll certainly talk to you and connect you to an ophthalmologist if you don't already have one, to see if there's anything else that we can do. But generally speaking, it's usually a temporary issue, and I tell my patients that. Numbness. It's normal to have some numbness along the lower eyelid after surgery, and that is usually present in most patients. Just like any procedure you do, there's going to be some surrounding numbness due to the swelling, due to the nerves being stretched out. But it's usually a temporary thing and not a permanent thing. Eyelid skin has the smallest dermal layer, perhaps in the whole body. There's minimal tension in that area. And when we close it with very fine sutures to allow that area to heal well. Keloids just do not occur in the upper eyelids, but what can occur in the upper eyelids, which is completely normal, is just a slight thickening of the skin, and I see that in a lot of patients. That's not keloid. Keloids is when the scar tissue goes beyond the incision. So if the incision is like right here, and there's sutures that come from side to side to close the wound, a keloid is essentially scar tissue that occurs around it, and it's a very significant and severe type of scarring that can be genetic. It could be ethnic derived as well, and certain ethnic populations are more at risk for them. But we just don't see that in the eyelid because of the reasons I mentioned. But I still, in my practice, encourage my patients to apply an antibiotic ointment for the first week to keep that incision hydrated, to allow that incision to heal as well as possible. It's all about postoperative care. Skinuva Scar Cream is a product that I've developed. This is the first product that I developed in the family line of Skinuva. And this product has been clinically proven to be 2 times more effective than the use of silicone cream when it comes to healing scars. It also helps improving the thickness of scars, pigmentation of scars, the redness of scars. I have a very strict protocol when it comes to managing my wounds after surgery, which includes the use of topical antibiotic ointment, switching to Skinuva scar cream 2 weeks after surgery, which you'll be using this for at least 3 months, twice a day.